Are you the parent of a child with autism or a toddler showing signs? Your child might be on supplements or medications, or you're trying some type of therapy, and you just have no idea if it's working or how to tell if it's working. I'm Dr. Mary Barbera, and I have an easy way to keep track of what's working and what's not, and I'm almost positive you've never heard of it. As I said, I'm Dr. Mary Barbera. I'm a registered nurse, behavior analyst, author, and I have been in the autism world for over 25 years, first as a confused and overwhelmed mom, and then as an autism professional. So my son, Lucas, who's now in his late 20s, he was pretty mild-mannered, always had language, but not a ton of language. He still is not conversational. He needs 24/7 care. But over the years and over the decades, Lucas has been on over a dozen traditional medications before I developed this system to help me keep track of what's working and what's not. So back when we were trying all these different traditional medications, we were trying gluten-free diet and we were trying different supplements, and I didn't know what I was doing. The medications he got on, and then we stopped. I don't know how old he was, what dosage the meds were on, how much he weighed, what the side effects were, why we took him off, what symptoms were we trying to help. It just kept going like that until I developed this system. And I think when I started to develop it was when he was 6. He developed pediatric autoimmune neuropsychiatric syndrome, otherwise known as PANS. I've done a few videos on PANS. We can link in the show notes. And Lucas was treated at the time with multiple courses of antibiotics and steroids. Over those years, when we were treating him under a doctor's supervision with so many different medications to try to help, I developed my calendar system. It's fully described, the whole calendar system is fully described on page 83 of Turn Autism Around. It's my 2021 book, and on page 83 literally has the calendar system. It has a sample calendar. I'm going to talk to you about it now, but there is a way to get this exact sample so that you can read it by getting the book resources I'll tell you about at the end. It really is great for any child or adults with a chronic medical condition where you're trying different things and you're trying to keep track. And I think with my hat as a registered nurse and as a behavior analyst, it really is a great system. So here are 5 steps to take to start my calendar system today. So step number 1 is get a physical monthly calendar for your child. This is an old one I had laying around. Now, I know what you're saying. You're just thinking, Mary, I use an electronic calendar, everything, and I don't use physical calendars. But the beauty of a physical calendar is that and especially a monthly one, is you can have a full view of what's going on. In red pen, we mark down anytime Lucas has any medical problems, any antibiotics, any self-injurious behaviors, any major issues. This month has very, very little red. We can, at a glance, know what's happening. All of my other stuff is on electronic calendars. That's fine. This is a dedicated calendar. In the front of the calendar, step number 2 is Velcro, a red pen, and a pencil. So pencil are non-medical, just kind of scheduling or doctor's appointments that you have to remember. And then the red pen is for anything that you're going to want to track. Step 3 in starting the calendar system is decide what you're going to track. Anything that's existing probably doesn't need to be tracked, but if you're going to change a dosage, if you got blood drawn and it showed, low potassium or low iron, and your doctor has recommended increasing your iron supplements, or whatever the situation is, if you're going to try new medications, new supplements, new type of therapy, and if you're trying to potty train or your community outings are looking really bad, you can track on a scale of 1 to 10 how well that community outing went, where you went, who went along, what happened, just very briefly. I mean, you don't have a lot of room to be writing a whole novel, but you can get to the point, and you can do pain levels. You can do on a scale of 1 to 10 how well something went. You can do potty accidents. You can do nap times and wake ups at night. So decide what you're going to track for your child. But this calendar is just for your child and just for you to decide what you're going to track. What you track today might not be the same thing you're going to track in 3 months. And you don't need to track things that are stable, things that you're not changing. Those can stay out of the calendar, just new things. Step number 4 in starting the calendar is be consistent and look for trends. And step number 5 is bring the monthly calendar to medical appointments and share behavioral data with your school team, with your behavioral team. We share this in order for the behavior analyst to write Lucas's annual treatment plan for his services. There's all kinds of things you can use it for. So if you want to get this calendar going, use those 5 steps. And also, if you want to get the sample, the book resources with page 83 and book resources from most of the chapters in this book, you get all the free resources. You can read chapter 1, listen to chapter 2, and get all these resources at turnautismaround.com, or click the link on or around this video, or comment. So if you like this video, I'd love a comment, thumbs up. Don't forget to download the free book resources at turnautismaround.com, and I'll see you right here next week.